These are some of the most popular questions I've ever gotten from my last video. Let me get into them. This is hands down the most common question. What is the best age for a facelift? Should I wait until after menopause? Should I do it before menopause? Remember, my job as your surgeon or anyone's surgeon is to tell you whether you're anatomically ready for a procedure and if that procedure is in line with what your goal is. I can't choose the age for you. And the reason is you could be bothered at 45 or not bothered at 75. It really depends on what's bothering you. Sure, will things get potentially a bit worse at menopause? They might, but if you do it earlier, you have the argument of more time to enjoy it. And if you do it later, maybe you only have to do it once in your life. The most important thing is, what is your goal? What are you after? And can I meet those expectations? I can't pick the age for you. I can just tell you if you're an anatomic candidate. As you know, I treat a lot of patients with melanin-rich skin. So this person is asking, I've had Cosmelan, can I do lasers? Remember, Cosmelan, which I offer, is probably one of the best depigmentation systems for the skin, especially for skin of color. Lasers can be very tricky for melasma. Here's why. Melasma is hyperpigmentation in patches on the face that is not only hormone sensitive, but it's also very heat sensitive. So yes, there are lasers that work very, very well for melasma, but you have to be okay with a potential risk of making your melasma worse. If that's not something you're willing to accept, it may not be for you. I do a lot of things to prep patients' skin if they have melasma during the treatment and after to make the treatment so much better and to reduce that risk of a melasma flare, but you have to be okay with the very small risk of it happening. Most laser companies won't actually tell you this, but in their diagrams and in their descriptions, they will say these lasers are contraindicated in melasma patients, even though we use them for that and we know they work. So you just have to be careful. Okay, the very popular muscle exercises on the face. Does M-Face prevent your face from falling off? Let me tell you something. I've said this before. Exercising the muscles in your face does not prevent them from drooping with age. And the reason is, it is not just the muscles, it's not just the ligaments, it is a very complicated deep tissue network underneath the skin that is contributing to this process. So the short answer is no. M-Face or muscle stimulation won't be the thing that prevents it from falling down. The other thing to remember is that M-Face is combining radio frequency with muscle stimulation. In my opinion, the main benefit of M-Face or any of these muscle stimulating devices is that radio frequency part. Just the muscle stimulation, probably not going to do anything for you. And remember, what do we do to make you look younger in the upper part of your face? We paralyze your muscles, right? We weaken these forehead muscles, the muscles between the brows, the muscles around their eyes with Botox. So why would stimulating the muscles or trying to strengthen them make your face look younger? It does not. That's bullshit. Not only do I enjoy doing this, but I have an obligation as a doctor to share useful information for you. So the best thing that you can do is give me questions to work with. Drop your questions in the comments below. I'll see you next time.